Empathy for pain and presentation of solutions. Stiff fingers every morning when you wake up, and aching knees every time you go up and down the stairs. Are you just enduring it, thinking, it must be my age? If you thought that surgery was the only answer to solve this persistent joint pain, you must watch today's video until the end. A board-certified orthopedic surgeon reveals a surprisingly simple way to manage joint pain without surgery, based on decades of experience. The miracle management method that will change your daily life with just 10 minutes of investment every day. Let's start right now. 10-minute miracle routine to relieve joint pain without surgery. Part 1. How to treat finger arthritis without surgery. First, it's finger arthritis. Especially women complain a lot about finger joint pain while doing dishes or housework. The reason why women have a higher incidence of finger arthritis than men: frequent use, hormonal changes. Orthopedic surgeon emphasizes that most finger arthritis can be sufficiently managed without surgery. The secret is this: it's warm water and accurate stretching. The best treatment that doesn't cost money. Warm water compress and stretching. The method is really simple. In the morning and evening, receive warm water of about 40 degrees in a wash basin and soak your hands in it for 10 minutes. Promotes blood circulation. Relieves stiff joints. As blood vessels expand, blood circulation becomes smooth, and there is an effect of softening the joints and muscles that have been stiff overnight. Expensive paraffin therapy machine, you don't need it. Invest just 10 minutes every morning when you wash your face. Now, here is the core stretching to relieve pain. It's different from just clenching and unclenching your fist. Watch closely. First, it's folding by joint. With your hand open, bend only the first joint for 5 seconds, then bend up to the second joint for 5 seconds. Stage 1. First joint only for 5 seconds. Stage 2. Both joints for 5 seconds. Second, it's bending backward. With the other hand, gently bend each finger backward and hold for 5 seconds. Gently bend fingers one by one for 5 seconds. Repeat these 2 movements for each finger about 5 to 10 times. It is the best preventive method to strengthen even the small muscles around the joints to reduce pain and prevent deformation. The appearance of the finger's internal muscles being strengthened by stretching. Part 2. Knee pain. A management method that is 100 times better than walking. Next is the knee. If your knees hurt, many people start walking exercises indiscriminately, saying, you have to build up your muscle strength. However, director warns that this can rather wear down the cartilage. Especially if arthritis has already progressed, the impact during walking puts more strain on the knees. Then what should we do? The answer is asterisk, asterisk. Impact-free strength training, asterisk, asterisk. I will tell you 2 of the best exercise methods that the hospital recommends. First, it's leg lifts while sitting in a chair. Sit in a chair with your back straight and lift one leg straight up so that it is level with your knee. Hold this position for 5 to 10 seconds. You will feel the muscles in the front of your thigh getting firm. Thigh muscle strengthening absorbs impact to the knee. The second is indoor cycling. It is important to adjust the saddle height so that your knees are almost fully extended when pedaling. It's the best cardio exercise to strengthen the entire thigh muscle without impact. Correct saddle height indication when riding an indoor bike. Shall we talk about knee injections too? There are often bone injections and cartilage injections, and the 2 are completely different. Bone injection, steroid, versus cartilage injection, hyaluronic acid. Steroid injections, called bone injections, quickly eliminate pain with a strong anti-inflammatory effect, but if you get them often, there are side effects that weaken cartilage and tendons. So, you should use it only when it's really necessary and in a limited way. Cartilage injection is a much safer injection that supplements ingredients that act as lubricants for the joints. Therefore, it is important to get into the habit of checking with your doctor what kind of injection it is before getting the injection. 1. For finger pain, 10 minutes of hot water compress and stretching by joint every day. 1. For finger pain, 10 minutes of hot water compress and stretching by joint every day. 2. For knee pain, Instead of walking, impact-free strength training. Screen 3. When getting an injection, be cautious with bone injections and be sure to check the type. Do you know what the commonality of the methods we've introduced today is? It's that they are not expensive and that you have to be consistent. Arthritis is not a target for complete cure, but a disease that needs to be managed consistently throughout life, like maintaining a car. Let's manage it before it breaks down. Please remember this phrase: a small habit that starts today will protect your joint health for 10-20 more years. If today's content was helpful, please subscribe and like, and share this video with your precious people. I will always support your healthy daily life. Thank you.